Agimlisin 5 uses, dosage, and side effects. Agimlisin 5 is a medication that contains the active ingredient lisinopril 5 mg, formulated as film-coated tablets. Lisinopril belongs to the group of angiotensin-converting enzyme ACE inhibitors, which work by relaxing blood vessels, lowering blood pressure, and reducing the workload on the heart. 1. Hypertension. It can be used alone or in combination with other blood pressure medications such as alpha blockers e.g., Prazosin, thiazide diuretics e.g., Hydrochlorothiazide, or calcium channel blockers e.g., Amlodipine for effective blood pressure control. 1. Hypertension. Lisinopril helps reduce peripheral resistance, dilates blood vessels, leading to a decrease in blood pressure. 2. Heart failure. It is used in combination with cardiac glycosides e.g., Digoxin, and diuretics for the treatment of congestive heart failure in patients who have not responded adequately to diuretics or cardiac glycosides alone. 2. Heart failure. Lisinopril improves heart function by reducing the workload on the heart, decreasing peripheral vascular resistance, lowering blood pressure, and enhancing blood flow to the heart. 3. Stable hemodynamically stable blood pressure. Acute myocardial infarction. Lisinopril is combined with aspirin, thrombolytic agents e.g., streptokinase, and beta blockers e.g., metoprolol to improve survival time in patients with myocardial infarction. 3. Stable hemodynamically stable blood pressure. Acute myocardial infarction. Lisinopril helps reduce the workload on the heart, protect the heart muscle from further damage, and reduce the risk of death. Important notes. Agimlisin 5 should only be used as directed by a doctor. The dosage and duration of treatment depend on the patient's condition, response to the medication, and the doctor's instructions. Do not use the medication or change the dosage without consulting a doctor. Important notes. Report any adverse reactions to the doctor. Contraindications: hypersensitivity to lisinopril or any other component of the medication. Pregnancy during the third trimester. Severe aortic stenosis. Severe mitral valve stenosis. Cardiac shock. Concomitant treatment with other ACE inhibitors. Precautions: use with caution in patients with renal insufficiency, liver insufficiency, diabetes, elderly patients, debilitated individuals, and those taking other drugs with similar effects. Pregnant and breastfeeding women should consult a doctor before taking the medication. Precautions: possible side effects include dizziness, lightheadedness, nausea, vomiting, headache, abdominal pain, cough, fatigue, and elevated potassium levels. If you experience any side effects, contact your doctor or pharmacist for advice and prompt treatment. Precautions: this article is for informational purposes only and does not substitute medical advice. Consult your doctor before using any medication.